Thank you for inviting me today, and I hope you enjoy your lunch while you're watching this. The title for our program is Governing Health Information for Better Health, the Healthcare Consumer's Expectation. Today we're talking about the new healthcare consumer, who they are, how they were created, and what it is that they're looking for. We're going to talk about the huge increase in health data and what that means to the health record. We'll also look at some trends that will push healthcare to the tipping point of major transformation. Right now, it's chaotic, but that won't last forever. Perhaps most important to some of you who are listening, we'll talk about the impact on you and your job. HIM professionals are concerned about where the field is going. Your roles are changing, and they will continue to change more. Your job used to be primarily about coding records for billing, pulling medical records. It used to be a paper world. But today, it's a digital and paper world, and tomorrow it will be nearly all digital. It's also going to be about stepping up to help the consumer. After our session today, you'll have a better idea of what's going on, what's driving the consumer and their behavior, and you'll see that it's going to change your role so that you end up interacting with the patient directly more frequently. There will be different options for your professional role. At the end of our conversation, you will know how consumer behavior and trends in healthcare affect your ability to govern health information. Before we start, I wanted to tell you just a little bit about myself because you might be curious about who I am, why I think the thoughts that I have, and why this is important to me. I was trained and educated in biostatistics or biometrics, and simply that's just applying statistical analyses to biological data. One of my first jobs was as a data director for an organization that monitored the care of Medicare and Medicaid patients. Some of you may remember these as professional standards review organizations. Because medical records were paper back then, and the patient data had to be reported back to the Department of Health and Human Services, the ICD-9 codes had to be added for data entry of each concurrent review. So it was my job to analyze the data from the reviews for patterns that might indicate overutilization or quality issues. I presented the findings to the Physician Data Review Board, and it was their responsibility to monitor and address physicians who were outside the norm. So the analyses I did were dependent on the reviews being coded accurately. And let me tell you that if you are bringing information for doctors to question the care of other doctors, you better be solid and the data must be accurate. So to do that, I worked with two RRAs. One was the data supervisor, the other was a quality director. These two individuals had a lot of experience that came from working in hospitals. So they understood what happened in the hospital and could often explain a patient's care by reading between the lines. Aside from clinicians, you are the professionals who know the most about a patient's care. The job you have to do today is extremely important to maintain integrity of the patient record. It's also more difficult because you're receiving more data from multiple external sources and the data is coming very rapidly. Some problems have gotten worse with the conversion to digital records, such as patient identification. Still, though, it is up to you to keep the record accurate and maintain the integrity of data used in analyses. So I empathize with the hard work you do and the changes that are happening. I believe that your work is very important to the future of healthcare. So let's get started. Today we're talking about the healthcare consumer because their behavior is changing healthcare, the way it's delivered, who offers it, and as a result, the tons of data that are generated. So let's start by defining the healthcare consumer, the customer, and the patient. These are the definitions that we'll agree to use today. Yours may vary, but if you don't mind, we'll just use these for today, and they're loose. So in the past, everyone was a patient if you had a doctor. Some people, though, today don't like to be called patients unless they're sick. The customer is a person who uses a healthcare service or product, and the consumer is someone who shops for products and services. There is some overlap between the definitions, so they are soft. One person can be all three of these at different times. But the consumer is new to healthcare because in the past, there was no shopping for healthcare. Why do you want to understand the consumer? Because healthcare is a competitive world now, and the consumer holds the keys to beating the competition. The consumer who wants care has to pay more through deductibles and a bigger share of premiums. You have a healthcare consumer who is choosy about where to go, what to do, and how much they want to pay. Let's look at competition. First, let me read you a description of a new product offering, and you tell me who the company is. Name a company that's not in healthcare. You can enter answers on the chat screen. Here's the definition. Each custom-built yacht offers an intimate journey with space for only 298 guests. Accommodations include 149 suites, each with its own balcony, and several luxurious duplex penthouses. Cruises feature thoughtfully designed modern interiors, destination-based activities, local chefs, artists, and musicians, luxury amenities including a top spa, elevated dining including a 3-star Michelin restaurant. So did you guess Crystal Cruises? Silver Sea? Royal Caribbean? Maybe Regent Seven Seas? That's right, the answer is Ritz-Carlton, the luxury hotel chain and the first hotel chain to join the cruise business. So the point of this is that competition is dynamic and comes from outside the industry. Technology and other non-healthcare companies are dabbling in health as well. Google tried to build on flu predictions. Microsoft had the Health Vault. Not all of these have worked out, but that doesn't mean they have given up. Apple has Apple Care Kit, Health Kit, Research Kit. Its latest edition is working with startup Health Gorilla to add diagnostic data to the iPhone, including blood work. The interesting thing is that they are integrating with hospitals, lab test companies, and imaging centers. Health Gorilla says its goal is to give physicians a complete view of a patient's health history. The outcome is that the patient will be able to use their own iPhone to present medical information to physicians wherever the patient is at. Does this sound a little like a personal health record? Another example is Uber, the ride-hailing company. Every year, 20% of the population catches the flu, but it doesn't have to be that high. Uber's scientific rationale was that every person who receives a flu shot reduces the chances of others getting the flu by 50 to 60%. They gave away flu vaccination packages through their app for free. The free package allowed up to 5 people to receive vaccinations at a location selected by the customer. If you're wondering if the Uber driver gives the shots, the answer is no. The driver brings a registered nurse to the chosen spot and the nurse does the injections. Google's DeepMind, an artificial intelligence company, rolled out an app in London that helps doctors and nurses spot kidney failure. Google also has a company that makes apps that use sensors in smartphones. One app can detect jaundice in newborns using the camera and flash, and another uses the microphone to measure the strength of a user's breath, which could identify asthma, cystic fibrosis, and heart disease. Healthcare competition can come from anywhere. Amazon could be next. You know, they just bought Whole Foods. They could open a well clinic in Whole Foods stores. They could do children's sport physical forms, immunizations, and nutrition and diet counseling. They could deliver medication the same day to your home with their amazing delivery service. So what does it mean to be competitive in healthcare? So I'm going to ask you again to enter on the chat screen. What are the 2 things you believe that make a hospital competitive? In other words, how would you choose a hospital for a non-emergency visit over another hospital? It can be service, it can be ratings, anything that will help you decide. Some of you entered, the hospital is in my network, the doctor is in my network, it's easy to get to, it's convenient. Those are all correct things. Those are all right. These influence the consumer experience. So let's talk first about the consumer. Why is there now a consumer? After all these years, we haven't had a consumer in healthcare. Healthcare has never really been competitive because of the way it was structured. The U.S. has employer-based insurance, and most people are insured through plans that are offered by their employer, and the employer negotiates the benefits of these plans. The employer used to pay for most of the premium, and employees contributed a small amount each month directly from their paychecks. So here are the biggest reasons why we have a new healthcare consumer. Today, the plans have substantially changed due to the Affordable Care Act requirements. Insurers are mandated to provide 10 essential benefits in all of their plans, and this was not true in the past. As a result, insurance companies have increased the deductibles. a minimum of $1,300 deductible, although many plans have higher deductibles up to $6,000 for individuals and $13,000 for families. Employees also have to contribute more to the premium each month. Together, these form the higher out-of-pocket costs. Individuals are required to have health insurance. It's a mandate from the Affordable Care Act. There are also more convenient and accessible places to get care now without having to wait weeks for a doctor's appointment. New delivery methods give consumers the option to spend less and get convenient care. You can get advice, diagnosis, and a prescription through a video visit at a retail clinic or urgent care center. All of these offer less expensive alternatives to the traditional hospital ER and hospital outpatient clinic. Now, all of this is what's created competition for the consumer's dollar. Let's look at what one doctor says about competition from retail clinics.
As we get older, America is likely to face a shortage of doctors, but basic clinics at chains like Walgreens and CVS are trying to fill the gap. Dr. Kavita Patel is an internist at Johns Hopkins Hospital and a senior fellow at the Brookings Institution. Welcome.
Welcome. Thank you for having me.
What's the issue here?
So the issue here is that people are finding these clinics as real convenient options. About 40% of Americans live within a 10-minute drive of one of these clinics. And you can go, get your condition seen, and then go out into the aisles and buy your drug that you might need or any supplies.
Walgreens has announced they are expanding these clinics. People have been using them for a long time for sore throats, common cold, sort of those types of visits to get a flu shot. Now, however, these clinics say they're going to treat much more serious diseases.
That's right. So part of the expansion has been threatening to some doctors, even clinics like myself, the one that I practice in, have thought this could be a replacement. But up until now, as you mentioned, Nora, they've really just been for straightforward conditions.
So you think they're good or bad?
So they're good for certain things. I think if you do have a very straightforward condition, when people have looked at the quality of care for the treatment of sore throats, ear infections, urine infections, they've found no difference between retail clinics and your regular doctor's office.
So how do you know when?
Are they actually cheaper to use them?
They are cheaper to use. A study by the RAND Corporation looking at 3 conditions, ear infections, throat infections, and urine infections, found that going to a retail clinic can be 30% cheaper than a regular doctor's office and up to 80% cheaper than an emergency room for those conditions.
All right, Dr. Kavita Patel, good to see you.
Thank you for having me.
So as now you can see that healthcare is similar to other industries where there are choices. The consumer can look for quality, price, convenience, and other things that are important to them. So who is the new healthcare consumer? You are a consumer. I am one too. So there isn't just one type of consumer. Consumers are diverse, just like our population. How we behave is affected by our culture, income, and a whole host of environmental influences. So in the past, doctors gave patients orders and most of the patients tried to execute to the best of their ability, whether they understood the doctor or not. It was a hierarchical relationship. The doctor talked and the patient listened. There's more than one type of consumer. And these are some of the characteristics that make up a consumer. You can construct your own target consumer from this list. In fact, you probably have more than one. But one thing is certain. The patient is an increasingly cost-conscious, demanding, and empowered health consumer. They are struggling with costs, chronic care, management, and access to information. Here in California, language and cultural barriers also prevent access and contribute to health disparities. What do healthcare consumers want and expect? A better experience, one that's simple, easy, and secure. Here's what customers want. Number 1, customer service is a key part of the consumer experience. Treat me like a valued customer. Know who I am and my history. Anticipate what my needs are based on my lifestyle. Know my preferences and give me choices. Healthcare is most often cited example of poor customer service after cable TV. First, you have to wait on hold for 15 minutes with the annoying message saying, we're experiencing an unusually high volume of calls, so wait times are longer. That's code speak for we have a lot of complaints and we don't hire enough people to take care of them. So you need to spend half your day waiting. Oh, and if you decide to call at a different time or day, you get the same message. So that translates to me that it's not unusual to make you wait, and the call volume is always high because our product or service is poor and customers have to call us all the time. So listen to this. Does this sound like a typical customer service representative when you call? So sorry to hear the product broke or the service isn't working, but unfortunately, it's not our fault. It's outside the warranty or you have tried to do something beyond the normal use. But we'd be happy to repair it for twice the cost of the product or send someone out to check on it. Just be sure that you can stay home from work for the 3-hour window during which we may or may not show up. Oh, by the way, we're supposed to tell you that we really appreciate your business. So contrast that with, what does good customer service sound like? Take a page from Apple. They know who you are when you call. Welcome back, Judy. They ask if this is the same problem you experienced last time. But best of all, you don't have to answer 5 questions to verify your identity. Fast, simple, easy. That's essential to top customer service. Number 2, be transparent with prices. For example, would you walk into a car dealer, look for a car, find one you like, and then ask the price, and the dealer says, I don't know, I can tell you after you drive it home and send you a bill. Many hospitals say they can't tell the customer how much a procedure or test will cost in advance. However, the hospital sends a bill after the procedure, so somewhere along the line they do know the cost. There may be complicating factors, but the hospital knows what those are based on previous patients. So it doesn't really make sense to a customer that you can't tell them a price. Now, Florida may have one of the best transparency laws so far. The state health agency must contract with a private vendor to provide a consumer-friendly internet platform that allows consumers to compare the cost of healthcare services in hospitals and ambulatory surgery centers. The price data is based on what providers actually receive from payers, not on the chargemaster's sticker prices. The prices are accompanied by quality measures. Hospitals and surgery centers must provide estimated prices by facility, geographic area, and nationally. To avoid surprise bills, hospitals must notify prospective patients, note that's before the fact, that other providers who deliver services may not be in the same health plan and will bill separately. Hospitals must also disclose their facility fees. What about health plans? They have to provide on their websites a method for members to estimate their share of the costs for both in-network and out-of-network providers. The Florida law goes one step further. Consumers can request good faith estimates for non-emergency services from hospitals, surgery centers, and individual healthcare professionals. And that estimate must be provided within 7 days, or they face a daily fine for non-compliance. After they receive their services, the customer can request a clear itemized bill from the hospital or surgery center, and that must be presented within 7 days. For hospitals that know their costs and can tell consumers what it is, they have a competitive advantage. Better yet, be able to tell the customer how much they will have to pay out of pocket after insurance. That's transparency, and Florida shows that it's possible to be price and quality transparent. Number 3, provide access to convenient and efficient care. Customers hate to wait. No one wants to go to a waiting room surrounded by a bunch of sick people and sit around. Customers want to take care of their health during hours when they're not working. For most, that means evening and weekends and somewhere close to home. Number 4, care when and where you need it. Telehealth offers access around the clock for acute care and monitoring of chronic patients. House calls and telehealth for chronic disease patients are saving money and convenient for the patient. Number 5, some customers equate quality with price, but ratings of providers show that they are not directly correlated. Getting quality of care information is available from government and nonprofit websites such as Hospital Compare and the Leapfrog Group. Number 6, provide easy communication with doctors, including mobile devices, online appointment scheduling, refilling prescriptions, changing appointments, or asking a question. These are basic functions that customers want and expect to be able to do without having to call and talk to someone during business hours. Let's look at a clip and see what consumers say about paying and convenience. Then I'll finish with privacy and security.
How important is getting affordable healthcare coverage that you can understand?
When I interact with my health plan, I want accurate cost information for my visits before I go to my doctor.
You know, I've had to wait for my health plan to authorize procedures in the past, so any health plan that can authorize in real time is a big plus.
Now let's talk about privacy. I have 2 points on privacy. The first is that privacy is probably the most misunderstood aspect of healthcare by patients, providers, business associates, and other healthcare companies. It is often used as an excuse to avoid giving patients their health information, even though it is appropriate. It is also used by business associates who really don't understand HIPAA. I called an ambulance company to find out how much my mother's share was for ambulance transportation. I wanted to pay the bill. They asked if I had power of attorney, and I said no. And then they said they couldn't tell me. They needed to speak to my mother. Well, that's just not practical because my mother's in an assisted living facility, and when you talk to her on the phone, she may or may not understand you because you're out of context. So the agent wouldn't tell me how much my mother's bill was. So I decided I'll call back a couple of weeks later, and a different agent asked me if I had power of attorney, and I just said yes. She did not verify what I said and gave me the amount that was owed. Now, I did not try to get any other information. I did not ask for anything like any kind of diagnosis, how long she was in the hospital or what hospital she was at. None of those kinds of things that would have or could possibly have violated privacy. So there needs to be a lot more education about HIPAA. Businesses that work in healthcare need to understand HIPAA and be able to explain it so they don't make the customer frustrated and become a pain point in the consumer experience. Patients are also concerned about privacy, but not to the point where they won't share. In fact, many are willing to share their data as long as it's stripped of identifiers. And that brings me to my second point about privacy. What patients and consumers are not as familiar with is the ability to reconstruct the identity of an individual even though the identifiers have been removed. This can happen because the large databases can be searched and merged with algorithms, so identifiers can be linked to an individual with a high probability of being accurate. Re-identification can happen if enough of the consumer-generated data are merged into a database with other large data sources. Databases that collect information about consumer habits can pose privacy dangers. Those of you who know Netflix know they make suggestions for what you might be interested in watching. And today, they are very good at it. But in the beginning, they wanted to improve the algorithms that are used to make movie recommendations. So they had a contest. The prize was $1 million. As part of the contest, Netflix released anonymized data on 500,000 users and their ratings. 2 researchers at the University of Texas decided that they wanted to show that the anonymized data released for the contest could in fact be used to identify users. So the Netflix data itself did not have names, but the researchers also used the Internet Movie Database, IMDb. Some of you may be familiar with it. It's a public database. When the Netflix collection of movie ratings was combined with the public database ratings, it was enough to identify individuals, and only a handful of ratings were needed to identify the individuals. But the big public data sets also carry the potential to inadvertently reveal a person's identity even without a name attached. Information that a person believes is benign could be used to identify them in private databases. For instance, your shopping cart in a grocery store is unique to you. No one else puts exactly the same items in their cart. 2 years ago, researchers at MIT discovered shoppers could be identified by linking social media accounts to anonymous credit card records and bits of secondary information such as the location or timing of the purchase. So the problem is that modern data analysis tools are capable of finding links between large databases. Massive amounts of data are required to improve artificial intelligence, but new techniques are needed to protect customers. So Apple is experimenting with a new privacy technology aimed at solving a thorny problem. That is, how do you build products that understand users without snooping on their activities? So I won't go into the details on how this works, but the short story is that it blurs the data by adding noise and allows researchers to analyze sensitive data such as medical records without being able to tie the data back to specific people. And this technique is called differential privacy. So people assume that once data has been anonymized, it is good forever. Now, you know that's not necessarily true. Consumers need to feel safe that their data is secure and privacy is intact. I believe that the HIM professional will be asked by consumers and patients about privacy and how it works, what protects them, what doesn't, and how do they keep themselves from inadvertently putting their data where they did not intend. You are the best positioned to become health data privacy advisors. Security. Have you heard of the dark web? It's the place where you can illegally buy illegal items, such as drugs, and other services or products that are not allowed on the normal internet. This is the place where the human trafficking takes place. The international health insurer Bupa experienced a huge breach when one of their employees stole data for 108,000 customers that included customer data, birth dates, nationalities, IDs, and some administrative data. The investigators for this breach found that the employee apparently had over 1 million medical records listed for sale on the dark web. PHI is very valuable on the black market. It can be used to get drugs, medical care, and commit insurance fraud. The FBI says a stolen medical ID goes for $60 to $70 on the black market, while a social security number only gets $1. But resolving medical identity issues costs an average, now this is just an average, of over $13,000. The costs are not just monetary. Medical identity theft can cause delays in treatment, misdiagnosis, and inappropriate care. The health data of the imposter is merged with the identity of the real patient, creating serious inaccuracies in health data that can be life-threatening. Patient identification may not always involve criminal activity. The Harris Health System in Houston published a set of data that demonstrates many patients share similar identifying factors. And of course, you all know that. In their published demonstration, they had 3.4 million patients, and among those, 2 patients sharing the same first and last name occurred over 249,000 times out of those 3.4 million patients. That's 7.3%. And that's really big. In that same set of data, patients sharing the same first name, last name, and birthday occurred almost 70,000 times. So that's 28% of those who had the same first name and same last name. Are these records unique individuals or duplicates? How many represent different people? Or is medical identity theft a factor? Figuring that out will be a challenge. If there is a breach, so you will find that the potential victim is knocking on your door to find out if their medical identity has been stolen and what they should do about it. Next, we have challenges and opportunities. I'll go through each of these challenges: requesting records, consumer engagement, sharing records, and consumer unfriendlies. Let's start with access. Easy access to medical records is one problem that is so big and affects so many people that the government put out a report on improving ways that patients can request and receive their health records. You know, if the government puts out a report, that it must be big and must be real. So that's how hard it is. I experienced how frustrating getting healthcare information can be. I had to complete a form so that my mother could qualify for paratransit services. They needed to know medically why she couldn't walk 50 feet to a bus stop, get on and off a bus, and wait standing up. So she'd had a stroke about 16 years ago, and she was fine, but now she's 90 years old and she can't walk too far. But the request had to go through medical records. It was a paper request and mailed to me through USPS mail. I filled out the form and sent it back via USPS mail because they don't let you email it back. And even though this wasn't a request for medical records, just the diagnosis and the doctor's signature, I had to go and send it to medical records. So I left voicemails for medical records when the machine said they would call back within 2 days, but no one ever called. So I emailed the doctor to ask him if he had signed it, and he told me he had to get his nurse to look through the pile of paper on his desk to find it. I called again medical records, Still no return call. And I finally had to call the paratransit company to find out they received the form. So initially they hadn't received the form. And by the way, this is over the period of a month. And then the next time that I called them, they had received it. And it took about 5 to 6 weeks. So couldn't this be done online? And by the way, if you ever have to leave a voicemail, you shouldn't say that you're going to call back people and then no one calls back. So too often patient portals are for the provider, not the patient. So the request for medical records through a patient portal still requires the patient to print the form, fill it out, and then mail it in. And we're talking about mailing it in, U.S. mail service, not email. Then it goes into a black hole because HIPAA allows 30 days to fulfill the request. And in that time, no one lets the patient know whether the request was approved and fulfilled or if it was denied. So think about this. When someone logs into a portal, haven't you verified who the requester is? Why do you need a piece of paper mailed in? It's inefficient to start completing something on a computer or smartphone and filling out a request. Then you have to print it out, sign it, and mail it in. Again, right, with finding an envelope and a stamp and a mailbox. So there must be a better way. Another scenario is when a patient transfers to new providers. This is important to note because more patients will be switching providers, especially if they change plans and existing providers are no longer in their network. This example is from ONC's playbook on simplifying record requests. This is about Rochelle. She's 26 years old, she switched health plans, and her old doctor isn't in the new network. All she wants is to transfer her records to her new doctor. But she doesn't typically use a patient portal because there isn't anything that she needs there, and she says it's a hassle to log in. So here's another important point. She's 26, so she's young, and she undoubtedly is used to being online, but she considers logging into the doctor's portal a hassle. So why is that? So she decides the first thing she's going to do is call her doctor and ask how to get the records. This is pain point number 1, right where that little frown face is. The doctor tells her to write a letter and mail it in. And she's thinking, can't this be done online? This is pain point number 2. Then she waits. The next thing that happens is that the doctor's office calls and says that she needs to pay for every page that is older than 2011. That's because the records before 2011 are all paper. She asks how many pages there are, and they tell her they don't know. So she says no, because the cost is unknown. Pain point number 3. So the records from 2011 arrive at the new doctor's office via mail. She goes for a visit, and she still has to fill out history forms, even though they have her records, because they are paper. Pain point number 4. So she says, I went through all the steps to get my record transferred. In the end, I feel like, why did I bother? I still had to fill out all these history forms, and none of my old vaccination records are in their electronic system. So what can be done? For now, providers can make the process less stressful for the consumer. Steps that providers can take to create a streamlined and transparent electronic health records request include allowing patients to easily request and receive their records from a patient portal, create a user-friendly, plain language online request process, use e-verification to quickly confirm a record requester's identity, and encourage patients to use portals by promoting features such as online appointment scheduling, messaging, and prescription refills. These are functions that the patient wants. If you don't have those on there, the patient is probably never going to come to the portal. Now, AHIMA has created an easy-to-use request form, which is an important part of the process. And this is where you, the professional, can create a process by working with IT that fits your hospital. Getting consumers engaged is another challenge. Consumer engagement is a big part of the healthcare experience. It is any mechanism that directly involves patients in their own treatment decisions and the ability to navigate the healthcare system. Here's one clinic that engages their consumers in governance, research, and payment reform to create a patient-centered clinic?
Center. So governance, we have a very active, strong consumer board. In terms of research, we have both a research committee and our own IRB. We have consumers on both the IRB and the research committee, and they have been instrumental in not only focus on the areas of research that are of importance to them, but also to ensure that they don't have a feeling that their community members are being in any way exploited. In terms of payment reform, we have listened to our patients, our consumers, in terms of developing supplemental patient healthcare home standards, in addition to the NCQA standards that have been put forth nationally. By adding these are standards that reflect the work that we at a community health center do. And again, it all pertains back to the patient. Patient-centeredness too often is defined by the so-called experts, the medical providers, the researchers. Rarely do we actually listen to the patient's voice and to what's important to them in their patient-centered healthcare home, and we have made an attempt to do so. Waianae wouldn't be Waianae without the level of consumer engagement. Fundamentally, we are a community health center established by the community and for the community. Patients play an active role in everything that we do, from developing our payment reform plan to doing the research that we do to being a voice in the state, not just the community. Patients and consumers are the heart of what Waianae does. Patients and consumers are the heart of what Waianae does. The risk would be that we wouldn't be Waianae. We would lose all perspective in terms of the work we do. We would be provider-centric rather than patient-centric. The voice of the patients is what drives all that we do, all the care we provide, all the research we do, and patients drive what community health centers are about. Communities, you know, it's part of the title of a community health center. We were established by communities and we serve the community. Without listening to the patient's perspective, we wouldn't be what we are.
Engagement is an important part of a patient's experience. There's evidence that patients who have more knowledge and skills around managing their conditions and who take an active role in treatment decisions have better outcomes and lower healthcare costs. Be where the consumer is. The retail and banking industries deliver information to me, the consumer, when I need it without my having to ask for it. By automatically sending relevant emails, I am kept up to date in real time. Labs and other results should be delivered within 24 hours. Right now, people wait days or weeks when the test doesn't take that long. Other methods of engagement. Connected devices. Sutter Health provided heart patients with connected scales and heart monitors that shared information via a remote patient engagement platform. These patients avoided readmissions within 30 days and saved a lot of money. Mobile messaging system. Miami Children's Hospital is using a mobile messaging platform that enables care providers to easily engage patients in their care by communicating not via a portal, but through real-time text messages. So here is another place where the HIM professional can help the consumer engage. They can provide assistance with the patient portals, ensuring that the latest information such as discharge instructions, test results, and medication instructions are on the patient portal. If they're not on a portal, then the patient will need assistance to locate the information from an HIM professional. Both of these sort of clinical patient engagements generate a wealth of data. The question for the HIM professional and the health system is how much of that data do you keep in the EHR? Health records sharing. What else do consumers expect from the healthcare system that's a challenge? A complete master EHR and the ability to share it quickly and easily. Patients are unhappy with the lack of a central location for their health records because it makes it difficult to access and share those records. They want efficiency and feel that doctors are wasting their time when they don't have access to their complete medical history, and they're more likely to make mistakes and prescribe wrong medication. Individuals want a single comprehensive medical record that all clinicians use and update. Lack of interoperability results in a provider not being able to assess a patient's entire story, which then leads to a negative patient experience. The system should take care of data sharing and care coordination. The patient wants to concentrate on getting well. So I have a true story where information was in the right place at the right time, and the patient got the right care because of a public health information exchange, HIE. The hospital was a level 3 trauma hospital, so it doesn't have a lot of specialized equipment in the ER. So what happened is that there was a glider pilot who crashed on the island of Hawaii and was luckily picked up by a helicopter. Now, the island of Hawaii is very rural because of its size and the fact there are really only 2 main highways that serve as transportation around the island. So it makes the ERs difficult to reach because if there is traffic, you are in trouble. So this glider pilot was actually lucky because he got picked up by a helicopter. The pilot was unconscious, but the ER doctor could immediately pull up his record and see his medication allergies, his history, and pre-existing medical issues, which was crucial to know before treatment. The assessment was fast because the ER staff did not have to find out who his doctor was to get his history and track the doctor down because this is on a weekend, or to wait to reach family members for information. So this was a public health information exchange, and that's significant because it means that the exchange connected unrelated organizations to each other to share patient healthcare information. This is something we hope never happens to us, but if it were one of us or a family member, wouldn't we expect that information critical to treating us is instantly available? Otherwise, treatment could be delayed or very conservative until they can reach a family member. Patient identification. We have smart homes. We need to have smart health records. One of the biggest problems that got exacerbated with digital health records is the ability to identify and match patient records. It's all the different names, spellings, middle initials that are sometimes used, middle names, maiden names, non-English names. You know all the problems. Some of the solutions suggested are unique identifiers for individuals. But I think bioidentifiers are the way of the future. A thumbprint, retinal scan, facial recognition, these alone or in combination will provide various levels of matching a patient or uniquely identifying a patient's record. So the challenge lies in integrating the records a consumer has from many sources into one. And that's a technical issue, one that can be solved today with enough willpower to collaborate and implement standards. Smart exchange without the consumer. We live in the age where technology can do just about everything for us. It can control our environment, adjust the temperature to warm up the house before we get home on cold nights, open the blinds in the morning, close them after the sun goes down. And now smart devices will respond to commands to order meals, find a movie, any questions you might have by looking it up on the internet. So these digital virtual assistants, Alexa, Siri, and there are more to come, should be able to get medical records from one doctor and send it to a primary care doctor. The assistant can provide the identity authentication, send and retrieve all of my personal health records, medical records, dental images, lab tests, and store my fitness information, including DNA, food intake, everything personal that has to do with health. This next video shows what consumers experience when information is not shared.
When I was in Savannah, I had an emergency C-section. My husband was approached about getting my appendix removed while I was opened up. Now that we live in Illinois and it's been 16 years, I'm not sure if I still have an appendix. It would really be helpful to have records that were easily transferred from.
Distinctly remember about 2 years ago, I changed personal care providers. And last year I went to my new provider and because I had to have a mammogram done. And they were not able to access my previous records from my previous mammogram. And so I distinctly remember I was very frustrated because I had to actually drive over and sign a consent form to really have that information released. I think it would have been really nice if that information, if my current physician could have accessed that information online.
Okay, so the best example I have is when I went into premature labor with my son Colin, and I contacted 911 and told them my history as far as how many weeks pregnant I was, what my blood type was, what I was diagnosed with so that they knew what I had. And then when 911 showed up, they actually went through all the procedures, got me stabilized, got the ambulance ready. But however, by the time I made it to the hospital, because I had a nice police escort, by the time I got to the hospital, none of that information I had given to 911 was translated to the emergency room, nor any of the physicians. So some of their decisions when I was in the emergency room were kind of those generic ones. So even though I had given them the blood type that I was, which was B positive, they gave me the universal. Not necessarily bad, because of course it saved my life. However, because they gave me the universal, I had an allergic reaction.
So that's the experience of patients whose health information was not shared. Not great, was it? So what's unfriendly? Waiting. I mentioned this before. Nobody likes to wait. Waiting is the #1 problem everywhere in healthcare and the top reason for patient dissatisfaction. In fact, health competitors have built their business around not waiting. Telehealth services offer appointments within 10 minutes. For the retail speed clinics, you book online and go at the assigned time. Traditional doctor's offices can be more helpful by sending a text to let the patient know when the appointment is delayed. Then they don't need to leave work. The patient doesn't need to leave work to wait. Or maybe they want to do something else instead of going and waiting in the doctor's office. Next, repeating themselves on forms for every doctor is like the movie Groundhog Day, where the main guy keeps reliving the same day over and over. So patients spend on average 8 minutes telling the doctor their medical history and 8 minutes filling out paperwork at the visit. These repeat scenarios stem from a lack of information exchange between providers. This is non-consumer-centric care. Consumers are expected to go to portals to request and receive information, but there need to be functions that the consumer wants. Improving customer service will lead to loyalty and positive word-of-mouth references. That brings us to the question of how do you know you are meeting the consumer's expectations? First, know who your consumer is and their needs. A mother in her 30s does not expect, want, or need the same things as a 50-year-old diabetic. Get in their shoes by mapping their journey in the health system and find out what their pain points are, and the same things for the staff. Find out what works and what doesn't work. Match the consumers with organization goals and align the needs with the offerings. Check your progress using internal and external surveys. This is a map of what a consumer journey could look like. Trends in healthcare. These are the trends that will take healthcare into the future. Your best friends forever, BFFs, Yotta and Zetta. Data is coming from everywhere. This is where the world is changing very quickly. It's changing your world even more because now there is an enormous influx of data from many different sources. So there are thousands of sources of health data. It's the Wild West out there. There are ingestible sensors, ones that you eat, some you stick on, some are in your house to sense whether you're alive and awake. So the move from analog to digital health data, EHRs, diagnostic images, and unstructured content, such as audio, visual, and text, are being stored in medical records. I put up here for your reference what a petabyte, exabyte, zettabyte, and yottabyte are. Every day, 2.5 exabytes of data are created. 90% of the world's data was created in just the past 2 years. So this mind-boggling amount of data is collected and stored in social networking profiles, blogs, mobile devices, cloud applications, data warehouses, you name it. Health data is expected to grow 48% annually. By the way, storage will not be a problem eventually. Scientists have found a way to store data in the structure of DNA. DNA has many advantages for storing digital data. It's ultra compact, it can last hundreds of thousands of years, and it won't become obsolete. So just as an example, 1 single gram of DNA can store 215 petabytes. That's equivalent to 215 million gigabytes. So yesterday, data was measured in gigabytes. Today and tomorrow, it will be measured in exabytes, zettabytes, and yottabytes. In 2013, the volume of healthcare data was estimated at 513 exabytes. By 2020, that volume will balloon to 2,314 exabytes. So to get an idea of how much data that is, imagine that all the digital healthcare data in the universe was stored in the memory of a stack of tablet computers. In 2013, if you took that stack of tablets, laid them on their side, one in front of the other, you would create a road of tablets from Los Angeles to London. That's 5,500 miles. 7 years later, that tablet road would grow around the circumference of the Earth 3.5 times, or 82,000 miles. But just having data isn't enough. It matters more how it's used and how it's connected to other data sources. So what do I mean by that? Well, people will join research studies as well as clinical trials. There are large nationwide projects to capture information for research, such as the All of Us Research Program, which is part of the Precision Medicine Initiative announced by Obama. All of Us will collect health data from 1 million volunteers living in the U.S. over many years. What does that mean for you? The consumer will join large research studies and many will participate in clinical trials. This is an area where the consumer needs advice from you on what should be stored and the levels of importance of data for their future healthcare. Consumers will want to control their own patient record and decide what to put in it. And they will ask you how to do all of this because no one else will know. Here's an example of data being generated from a clinical trial program. This is a patient, a young mother, who is in a clinical trial, and she has 2 young daughters. Telehealth is used to look at a rash, and as part of the clinical trial, the nurse does patient visits and collects data for the study.
Mommy's going to try a new treatment where I get to be home with you girls and Daddy. Mommy will have a whole team of people.
Let you know that I went over your recent blood work and everything looks normal.
Wow, that makes me so happy.
Absolutely. So just continue taking the medications and following the schedule on Nora.
Will do. Thank you so much for your help, Dr. Brown.
So, okay, so once you go on here, we're going to go through the Nora app, and then this way you're going to be able to communicate with me at all times as well as the study doctor. You swab samples. Doesn't look, it's easier than it looks. Nothing to be scared of. Just to keep everything clean and safe. Up here. If at any point you're uncomfortable, just let me know. Okay.
Hi, Tiffany. Hi, Marina.
Hi, Dr. Brown.
How's the visit going today?
Everything's going well. We just completed all the study procedures today without any problems.
Fantastic. Marina, how are you feeling?
I'm okay, although I do have a rash on my right arm.
On your right arm? Tiffany, can you show me the rash?
Absolutely. Would you like to screen, please?
So think about what data in this video could be added to the patient's record. Here's the secret. Consumers want healthcare to be healthy. There's a shift from sick care to well care. They haven't had healthcare. It's always been disease care. Now the emphasis is on living a healthy life and hopefully disease-free life. And precision medicine will help them live that way. This is where you find out from your DNA your risk of developing diseases. It will also tell the doctors how you will respond to specific therapies. At some point, a DNA sequence may become a standard in diagnosing and treating patients. There are a lot of devices out there. More and more people will start using them because health and prevention is what they want. Apple's in talk to provide Apple Watches to Aetna's 23 million health insurance members for free or at a discount. The question for you is, how does an individual's data, which can be in hundreds of places, from new delivery systems, medicalized smartphones, sensors, tracking and fitness devices, how does that get integrated into their health record? Consumers will want to add some or all of this data to their master health record. I believe DNA analysis will be used regularly in diagnosis, treatment, and prevention within the next 10 years. It is much faster, and cost of sequencing DNA is now down to $1,000 and dropping. Knowing and understanding one's DNA will play an important part in an individual's health over their lifetime. As scientific research advances, more aspects of humans will be explained by their DNA. People are inquisitive by nature. They want to know what's in their DNA. That's why there are companies that will tell you your ancestry. But there is also recreational DNA analyses that will tell you what kind of wines you will like based on your DNA and what diets work best for your personal DNA. At the population level, the Precision FDA platform is a cloud-based portal that will enable researchers across the U.S. to collaborate on innovations that will bring individualized treatment and potential cures for serious diseases. Doctors will have information that allows them to customize a diagnosis, treatment, or cure for a person based on their genes. DNA can eventually tie the health information of families together through their health records. This is why consumers will want to add their own DNA to their health record. I believe also that in the future, an individual's health record will be comprised of multiple records that make up an individual's life. Why? Because a medical record can't be a one-size-fits-all. Each record will have its own uses, permissions, security. Each record may need to be coded differently because the data within it is different. So having multiple records also makes privacy a little bit less complicated. And these are the different life records: medical, behavioral, DNA, social determinants, nutrition, fitness, and family links. So just to spend a minute on the social determinants of health. Providers serving low-income people and other vulnerable populations for a long time have recognized that factors outside the traditional bounds of medical care have a large impact on healthcare outcomes. Think about the health impacts of smoking, poor nutrition, lack of exercise, substance abuse, lack of clean water, think Flint, Michigan, unsafe neighborhoods, and you begin to understand the major impact of the social determinants of health on morbidity and, ultimately, mortality. In the future, these types of records will bring a governance challenge to the health record. It may not be part of the record now, but individuals want a life record, which poses the question of what should be included and what should not be included in an official health record. HIM professionals will need to be involved in developing the standards for these records. Artificial intelligence. On a basic level, artificial intelligence can be defined as the ability of a computer to independently solve problems that they have not been explicitly programmed to address. Artificial intelligence in medicine is taking off because until recently there wasn't enough data to draw meaningful conclusions. But improvements in genomic sequencing and medical monitoring technology are changing that. Every person's genomic sequence alone generates billions of data points. Add that to the data collected by wearable devices, such as monitoring tools that track glucose levels, blood pressure, heart rhythm, and other measures, and researchers have a rich pool of health information. Computers don't forget what they've learned, making them perfect helpers for the biggest of big data analytics projects like personalized medicine based on genomics, and clinical decision support for complex conditions like cancer. Computers also don't have inherent biases, so they're more likely to produce objective diagnoses unclouded by preconceived socioeconomic notions about the patient, which can then produce disparities in care. They can also recognize shifts and patterns in data more quickly and comprehensively than most humans, so they may be able to predict conditions like sepsis before the patient even starts to feel ill. AI will touch all healthcare in some way. It's being used in many other industries, including self-driving cars. The AI being developed today will merge across industries and increase the rate of intelligence being developed. Artificial intelligence could result in true prevention or far better treatments. AI could also be used to contribute to solving the patient identification and matching problem. So in closing, let's talk about why the consumer and patient will come looking for you and why you will become one of healthcare's best assets in dealing with the consumer. We've looked at some of the situations that will come your way as the official keeper of health records, but it isn't by any means complete. More are bound to come with healthcare's many changes, and we don't know what those changes are. Consumers and patients are becoming more engaged and taking more control of their healthcare. This is why they will come to you. There really isn't anyone else who is better positioned to help them. So, here are the top 10 roles that I think that you have for the future, not in any particular order. Number 1, patient advocate. You are the best advocate for the patient. You are able to explain their health record to them. Number 2, the official judge of the health record, ensuring that the medical record is accurate and complete. More than that, you will be called upon to assist patients in getting their records corrected when there are errors. Patients who receive care that is not in their local area will expect that their record is integrated immediately without faxing or manual input. Number 3, interpreter. You will be the interpreter of the health record. This is why customers will come looking for you. They need explanations. They will ask you to point out if something is unusual. This could be a service offered by providers or whoever owns the complete patient record. Number 4, your expertise is required to make patient matching much more accurate. IT people know technology and the fields to match in creating a master patient index. What they don't know and understand are the clinical portions of the record that help determine whether the patient is a match to another provider's record. Patients will expect their medical records to reflect the care they receive, their diagnosis and treatment. And certainly, they don't expect to see someone else's information in their record. This will be important as people start to store more information in their EHRs. A privacy advisor and educator. Advise individuals and businesses about privacy, both HIPAA and non-HIPAA. A biographer of health to help patients and customers decide what belongs in their health record outside the official requirements. Some items they will want to include because it's important to the future care that they may receive. User experience specialists. Be a part of the user experience team that creates applications for providers and consumers. Number 8, sharing consultant. Help retrieve and share information for providers, for individuals, and advise consumers on who and what to share. Number 9, people will increasingly want to have their own health data analyzed because they don't have the knowledge or skills to do it. And number 10, expert in medical identity theft. Technology will be more pervasive. Many people do not realize that stolen health identities are far more valuable than financial IDs, and they need to be educated on the consequences and risks of stolen IDs. Teach customers how to protect their medical health identities. Why do you want your health records? Let me end with this. Patients have a right to ask for and receive copies of their health records. No questions asked. But many companies just don't get it. Epic CEO Judy Faulkner asked Vice President Joe Biden why he wanted a copy of his health record. She said he would only understand 10 pages out of the hundreds of pages. Here's his reply. None of your business, and I understand more than you think. And that, folks, that is the new healthcare consumer. Finally, I'd like to let you know that if you're interested in habits and obstacles in social media for healthcare, you can go to my website and under Contact Us, select Easy Sign Up for a free copy. My book is also available from a link on my website to Amazon.com. Thank you.